Let's do this. Facebook Live. We're going to do it live. That's Dr. Mazz, everybody.
Exclusively on SiriusXM's POTUS Channel, Channel 124.
My next guest has inspired today's poll question at Smerconish.com. It is as follows. Do you believe that compassion from physicians is not only proper and just, but that it also improves patient outcomes? Joining me now is Dr. Anthony Mazzarelli. He is the co-president of the Cooper University Healthcare in Camden, New Jersey, Dean of Clinical Affairs for Cooper Medical School at Rowan University, an old friend who is both a physician as well as an attorney, a bioethicist, a healthcare executive, and author of a brand new book I'll tell you about in just a moment. Mazz, let's begin February 27, 2007 with a horrendous crash.
Yeah, it is a snowy stretch of highway just outside of Uppsala, Sweden. Two commuter buses collide head on. One bus was trying to pass a truck on the side of the road. These buses collide, and it takes several fire engines, multiple helicopters, 10 ambulances to sift through the twisted metal, the wreckage, and hours to get all of the people who they can out. Miraculously, 6 people die, but it's amazing, 56 people survive. They take them to the local hospitals, and what they find 5 years later is that researchers interview every single one of the survivors. And using a rigorous methodology in the research, they find 2 common themes. The first, which is pretty expected, is that everybody remembered the pain of the accident. That's what you would expect. The second was unexpected, which was that all the survivors had a theme about the lack of compassion that they were shown from the caretakers when they were taken care of in the hospital, which is even more surprising when you find out they were across 3 different hospitals. And that is pretty common to what we started to find when we put together what we were looking at when we put this book together.
People remember the lack of compassion.
And it has an impact. And that's what we started to dive into, which is this idea of compassion in healthcare.
Meaning it has an impact in the outcome beyond how we as patients remember the experience?
It has an impact in really 3 ways. So, and when we say compassion, by the way, what we're talking about is the relationship between those that give care and those that receive it. The doctor-patient relationship, the nurse-patient relationship, anybody who gives care and those who receive it. So if you think about it, it's bedside manner would be another way to think about it. So it's the impact of that relationship on outcomes, on costs, and the actual impact on those that give the care. Because what we found is a crisis in the US healthcare system with respect to compassion and that relationship. And if you were to have more compassionate care, or you were to improve that relationship, you're going to improve outcomes, you're going to lower costs, and you're going to deal with what has become an epidemic, which is burnout among those that provide care.
You're here about 13 days in advance of the release of the book. By the way, thanks for the advance copy. It is called Compassionomics, the revolutionary scientific evidence that caring makes a difference. What made you want to pursue this?
So I was charged, I was the brand new CMO, Chief Medical Officer at Cooper University Healthcare. In 2014, I was the youngest person put into that position at the time. And now I had 400 some physicians who were underneath me. And I was charged by my boss to improve the patient experience and to improve physician engagement. And around that time, my boss at the time had also engaged a consulting company that gave me a list of things that we should do in order to improve those metrics. And I was not pleased with that list. They were all very soft and mushy things to do, in my opinion. They were the art of medicine things that I was concerned no one would buy into. So I turned to our #1 NIH researcher at the time. His name is Stephen Treziak. He's my co-author. And I turned to him, and because he was our top NIH researcher, he's board certified in internal medicine, emergency medicine, critical care medicine, neurocritical care. He gets all kinds of grants to research resuscitation medicine and sepsis. He writes in the New England Journal of Medicine and the Journal of American Medical Association. And I said, Steve, I'd like you to be the champion for this within the organization. And he said, you're crazy. This is all the mushy stuff. Like, this isn't what I do. I'm the science guy. And I said, look, I need you to science this up. I'm not even convinced this is going to work. And if I can convince you, others will follow. Because we practice evidence-based medicine. That's what the physicians here do. Physicians everywhere do. And he said, okay. So he went back and I said, look, just look at the data. Tell me if there's any data on this. And he came back a little while later and he said, I'm finding some stuff on this, Mazz. And then as he looked further, he and I together started to find unbelievable amounts of data, but it was all disjointed. Because then we can talk if you want.
Data on the narrow issue of how compassion impacts outcomes.
If you were to increase the way you have a relationship with patients, if you were to do what we traditionally think of as the art of medicine, if you were to improve that, and knowing that we've gotten away from that, will you actually improve not only the patient experience, but will you improve evidence-based wise outcomes? And then we found you also improve costs, and we would improve the engagement and the satisfaction of our providers. And we were astounded of what we found. And so we decided to look at not just some of the data, but all of the data. And that's what we did over the course of several years.
I'm shocked that no one before you had done this.
Yeah, they haven't. And part of it is when these articles came out, the way we describe it is, each one probably made a little bit of like a pebble, a little ripple. Some may have made a splash, but no one's put it together to make a wave. And part of it is because, do you remember the search engine Alta Vista?
Yeah.
So if you were to
That was back in the day when my modem would go boop, 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 boop,
Exactly.
and I would have my telephone sticking in it to do it.
So we forget how great Google is now. If you wanted to search everybody in the internet named Charlie Brown, if you put in people named Charlie Brown, it would give you people named Charles Brown, Charlotte Brown, C. Brown, Charlie Brown. It would give you the whole list, right? The internet originally wasn't that smart. You would literally have to think about all those permutations. Well, in PubMed, which is the electronic way you would look for an article, you can look for, in medicine, you could look up pneumonia. You'd get every article on pneumonia. But it's not mapped for this issue. So you'd have to look up compassion, empathy, doctor-patient relation. No one's connected the dots before.
What's the universe of data that you looked at?
We looked at 1,000 abstracts and 250 articles, and we continue to look every day. But that was what was there when we actually put the book together.
And then in the book, you tie them all together.
We tie all of them together, and then we weave together real-life stories of patients.
Is this a subject that is capable of being measured? I mean, how can you? What's the control group? I'm thinking of the bus accident that you described in Sweden. Pardon me. I mean, what's the control group where you can say, okay, the outcome is better because physician X had a better bedside manner than physician Y?
So let's talk about that. There are a couple different ways to measure compassion. So, and there's several competing measures. One is to have the physicians actually take a survey. And there's a couple rigorous measured tools. One's called the CARE tool. One, actually, Thomas Jefferson University has one called the Jefferson Empathy Scale that you fill out. So there's studies where they had the physicians fill it out and they categorize them. And there's others where the patients fill it out. And then they look at the outcome. So a study at Jefferson looks at diabetes, let's say. They had the primary care physicians fill out this tool, and then they bucket them into low, moderate, and high compassion based on this tool that the physicians fill out. Then they look at the outcomes of the patients that had diabetes. What they found in those patients is that the patients of the primary care physicians that was scored to have high compassion had a 80-fold higher increase of having a normal glucose level and an 80-fold higher increase of having normal cholesterol in the group that was of high compassion. Then they went to Parma, Italy, where the database was 10 times bigger of physicians, looked at 20,000 patients, and the endpoint you care about in diabetes is diabetic ketoacidosis, all these complications, same results, 40 times higher. That people scored as high in compassion on this scale, they had the results.
Okay, naive question,
Yes.
basic question.
Do it.
Can compassion be taught, or is it an innate skill? I know you a long time. I know you to be a very compassionate guy. But can that which you have necessarily be imparted to somebody else?
Well, first of all, you say that I have. So I'm going to dispute that right now. No claim, neither Steve Trzeciak nor I, that we are more compassionate than other
But I
physicians.
just know you personally to be a compassionate guy. I assume that's the way you are in your practice.
I would like to think so, always working on it, right? And after reading a lot of these studies and seeing what people do, I don't think I'm at necessarily towards the top. I'm working on it. But yes, it can be taught. And in fact, if you go back to your science class, right, because what you're really asking is nature versus nurture.
Yes.
Right? And so the most common nature, the one that is, hey, you're born with this, is the stick your tongue out. You know, can you roll the sides of your tongue?
No, I can't. Yes.
Right? That's
Yeah.
the one that every
No.
science teacher says is the, so you want to know, is compassion that way? Is it something that is inherited, right? Turns out it's not. There's multiple studies where they were able to put people through some kind of training course, limited training course, in which they were able to actually learn how to be more compassionate. And the example we give, and it actually isn't ours, someone gave the example in a paper, it's like throwing a javelin. If you, TC, and I went outside now and threw a javelin, we would all throw different distances, but if we trained how to throw a javelin, we would all throw it farther after training.
But some of us are just not born to be athletes.
Some of us, right, but we'll still all throw it farther after we train.
I mean, I would like to think that medical school students could read Compassionomics and could acquire a skill set that maybe they didn't have that changes their bedside manner and improves the outcome of patients.
I think that's true, and I think that also if you have the skill set in the medical school curriculum, you can do it too. By the way, to go back for a second, the tongue thing, your high school teacher was wrong. That also can be trained.
Mazz, I want to ask about outcome. I want to ask about costs. I want to ask about the impact on healthcare providers. But
Sure.
convince me again.
You
Okay.
want some more outcomes?
Yeah, I want you to give me because here's what I'm about to do.
Okay.
I am about to open the telephone lines and ask this audience anecdotally what has happened in their lives. Do they believe that compassion by healthcare providers has impacted one way or the other the outcome of their medical course? But convince me based on data that you think it does.
Sure, so I'll give you a couple other ones. By the way, there's 22 different mechanisms in which compassion makes a difference in outcomes. So in other words, it's everything from it actually changes the physiology of the body to the connection that you have in that relationship to people being more adherent to their medications to there's all kinds of different mechanisms. But
Look,
I'll give you
I'm
another
just
one.
going to say something that popped into my mind, and
Sure.
I know that the callers are going to be the exact same way.
Do it.
I'm thinking about losing my father in October, and I was very pleased in a general sense with the health care that he was provided. But there were exceptions. You know, there were some who just did not seem to have any modicum of time. I think time is driving this bus, and you'll I'm sure want to address that. But then I'm sitting here saying, okay, in those rare instances where I don't think he was afforded the level of care that he should have been, did that necessarily impact his health? I don't know. That's the bridge I'm trying to cross.
And at times it does. At times it doesn't. Right? Nothing replaces good clinical acumen. We're not saying that you can make up for the slip of a surgeon's knife or giving the wrong medication with healthy doses of compassion.
Right.
But the absence of compassion is a patient safety problem, and the presence of compassion can improve outcomes. And that's what the data is.
Convince
very,
me.
very
Give
clear.
me something.
Here's another one. They went to Johns Hopkins. They go to an HIV clinic, and they ask one question of the patients: does your doctor know you as a person? It's the only question they asked. And when the answer was yes, they look at all of those patients, and what they found is that the patients in which they said yes had a 33% higher odds of taking their antiretroviral medications and a 20% higher odds of zero detectable HIV in their blood. That's what they found. This isn't our opinion. Right? This is what
The
we
data
found.
shows.
This is what the data found.
This is what I purport to offer here. Critical thinking, data-driven conversation.
Yeah, we were perfectly fine if the
All right,
hypothesis
all
would
right,
have been
all right.
that it didn't
Give me,
show.
give me one more. What else do you have besides a Sweden bus accident and HIV at Johns
And
Hopkins?
diabetes.
And diabetes at Jefferson.
How about low back pain?
Okay.
Right. So multiple trials about the perception of pain is lessened. Actually, I got one for you. How about surgery? You want to do surgery?
Sure.
So a visit.
I mean, it's hard for me to believe that a surgical outcome could be impacted by
So
compassion.
multiple studies dating all the way back 50 years ago in the New England Journal, right? It's a pretty big journal. That when you have a pre-op visit and a connection with an anesthesiologist, and anesthesiologists will tell you they know this, that if you have a connection with an anesthesiologist in that pre-op area, that pre-op visit with an anesthesiologist or a nurse, that you will ultimately, in the post-op area, need less pain medication, less opioid pain medication, and your time in the hospital is less.
I had a colonoscopy last week. You're making me think of all of my recent travails. Thank God there haven't been many. I had a really good experience. In fact, they had me fill out a questionnaire to take home with me, and I sent it back in because I wanted to give my GI, Dr. DiMarino, rave reviews. But every step along the process for my colonoscopy, the staff could not have been nicer, could not have been more accommodating toward me. I mean, from the receptionist to the anesthesiologist to the anesthesiologist. And I have to believe that put me in a better frame of mind. Nobody wants to undergo a colonoscopy. It improved my emotional response to it, but you're going a step further.
That matters. All of that matters. So here's one of my favorite studies is perhaps the longest scientific study that exists anywhere. It's called the Harvard Study of Adult Development. So it's a study that's been going on for close to 80 years. But I'm just trying to make the connection between the mind and the body sometimes. That's not the only mechanism.
Right.
Close to 80 years study's been going on. They took a bunch of men from Harvard. TC couldn't be in the study because there were only men in Harvard at the time they started the study. And some other teenagers in Boston. And they've been following them their whole life. They bring them in every year. They're still doing the study. And what they found is
I've read about this study.
the biggest predictor at age 50 of their health at 80 wasn't their cholesterol. It wasn't any of their
Can
health
I see
factors.
if I remember the result?
Yeah.
Was it the number of relationships that they had?
It was
I
their
remember this.
satisfaction with their relationships.
Right.
Because loneliness kills. It's our connections and our relationships that matter. You can expand that to how you have your relationships with people has a lasting effect. So
Okay.
trusted others
I remember
right?
that. Yeah, I find that to be very compelling. Let's address the time issue.
Okay.
I don't know what I'm going to get from physicians. I'm sure all the lines are almost already lit. But my hunch is that physicians are going to call and they're going to say that they agree with Dr. Mazz, but hey man, I don't have the time because I'm on the clock and I've got to get from this bay to that bay to this bay. How much of this is driven by time and then really driven by insurance companies?
Not as much as you think. So let me do the
Rush thing?
the rush thing.
Go ahead.
So, study also Johns Hopkins. Okay, among they did. This is hematologist oncologists. This is one of several with the same outcomes. What they did is they took, they looked at the endpoint of anxiety in cancer patients, and unfortunately for cancer patients, sometimes that's the only endpoint you can study because the outcomes. That's the only one you can look at. And they did a compassion intervention where they gave one arm of the study something to read, a script to read. And the result was an incredible reduction in that outcome, a decrease in anxiety.
What was the script?
I'm going to read it to you.
Oh, okay.
This is how long you
Okay, help me understand this though. To whom was this read?
to the patients.
So I'm the patient. My
Right.
audience right now, we are the patients.
You're the patient,
and we're all
and I'm the
cancer.
doctor.
And we're all cancer
Yeah,
patients.
and they randomized it to the different doctors.
Okay.
So some patients got the script,
And some didn't.
some didn't.
Go
Here's
ahead.
the script.
Yeah.
They read this at the beginning of the visit, and then they read something at the end of the visit.
Okay.
Here it is. I know this is a tough experience to go through, and I want you to know that I'm here with you. Some of the things that I say to you today may be difficult to understand. So I want you to feel comfortable in stopping me if something I say is confusing or doesn't make sense. We're here together, and we'll go through this together. That's the beginning of the visit.
Okay.
The end of the visit, I know this is a tough time for you, and I want to emphasize again that we are in this together. I will be with you each step along the way.
Those who were read had what differentiation of an outcome versus the others?
Had a significant decrease. It was large. I don't have the exact number in front of me. Decrease in the endpoint of anxiety, which was the thing they measured. This is repeated all under a minute, not just anxiety. Every endpoint that they looked at in multiple studies.
Okay,
How long did that take?
Yeah.
40 seconds.
Okay, just to be a bit of a critic. Okay, I'm less anxious, but I still have stage 4 carcinoma.
No, well, that one's anxiety. But so let's go back for another one. Almost all of these ideas where they looked at the way they study compassion and the way you give it to patients, almost all of these, when they really get rigorous on this, they're videotaping the encounter and they're having people actually look at the language. All of these encounters where they talk about adding in compassion interventions, they're all less than a minute in what they have people do. Because if the idea is you have to spend more time, it's just not going to be a realistic intervention.
Okay, so let me quickly ask you, I'm not going to be able to cover it all before I get to the phone calls, but I want to address this. Let's address cost, because I imagine that there's some healthcare CEO listening to this right now who is saying, oh my God, we can't afford the compassion that Dr. Mazzarelli is recommending in the book.
No, you can't afford not to, right? So that's the whole, we had to address costs, because the only thing, and this is going to be cynical, the only thing that really changes behavior in healthcare is the reimbursement structure. So if compassion is going to change outcomes, but isn't going to be fiscally viable, it's not going to happen. So we had to look at what are the data around costs.
You doing this at Cooper? Are you employing these techniques as a means of, you think, holding costs or reducing costs?
We're doing research on this right now, and we're trying to employ this by bringing this out in our physicians. We actually had an article that was in the Encore yesterday. There's another one that's embargoed till later this week. So we're doing a lot of original research, and we're trying to have this. When we start to talk about burnout, that's the best part, the sort of three-legged stool of this.
You did say this impacts healthcare providers individually.
In a positive way.
Meaning,
that's the best part.
Meaning what?
So burnout is a huge issue. And I guess we'll come back to costs in a minute, but burnout, and really what we mean by that is physicians' depersonalization, emotional exhaustion, and not feeling gratification in their work. It's a growing problem in healthcare. 50% of physicians have some element of that right now across the country. It's a growing problem. And so most people try to solve this with what Steve and I call escapism. Wellness, go for long walks. I'm not saying those things aren't important. Hot yoga, soul cycle, and those things are important. But our position, the answer has to be at the point of care. There has to be something about patients that can be the solution here. So there are a lot of studies that if you would think that compassion, what do the studies show about compassion and burnout? Well, if providing a lot of people used to teach in medical school, when I was in medical school, they taught you, don't get too close to patients, because you'll get burned out. Well, it turns out that it's not the case that the higher the compassion, the higher the burnout. It's the inverse.
It actually makes sense to me, because I know that if I undertake a charitable act, maybe I'm giving money, maybe I'm giving time, maybe I'm just giving a benefit to somebody that I don't necessarily need, I do end up feeling better about myself.
Of course.
So it makes sense. I can't keep you all to myself. I want to include telephone calls and let people react. This is the survey question of the day. Do you agree with Dr. Mazz? And let me give a shout out to Dr. Stephen Tresiak as well, your co-author, that compassion from physicians is not only proper and just, but that it also improves outcomes. Now, I buried the lead, and I want to say this. Dr. Mazz is not only an accomplished individual who is both a physician and an attorney and now an author. I said he's an old friend. He's actually my original intern. So how cool that he should be sitting here as the author of a book that will be released on April 30. It gets better. I really hope that you'll be taken with the subject matter and that you will pre-order the book. I am asking for the order for Mazz now that he's laid out the thesis. You may also choose to listen to it at Audible. And if you do, you will recognize the voice who has recorded the entire manuscript.
Oh, that would be Compassionomics. Thank you so much. Yes, indeed.
Did
By
you-
Dr. Anthony Mazzarelli and Dr. Stephen Tresiak.
Do you want to say anything about that aspect?
It was such an honor, truly. I mean,
Aren't we proud of Mazz?
Oh, I am beside myself for Mazz. Mazz asked me to do this, and I didn't even think about it. It was an automatic, it was the most automatic yes of anything I have ever said. I believe in this book and in Dr. Mazz so much, and it's an extraordinary book. It is the science behind something that makes so much sense in your heart. That's how I see it. And I can't be more happy and honored to be part of this.
I think in my blurb for the book, I said, compassion from physicians isn't only proper and just, it actually saves patient lives. So, the book is called Compassionomics, the revolutionary scientific evidence that caring makes a difference. Stephen Treziak, Anthony Mazzarelli, Mazz to us. I'll include your telephone calls in just a moment at 855-486-1776. Let me also mention we have delivered live for Facebook the original portion of this conversation. So by all means, go to my Facebook page if you want to actually watch how the whole discussion unfolded. There are a few things in business as painful as not knowing how sales is tracking to plan. The